by the name of Rick Werner, and the brother and the sister of a young man by the name of Jamie Werner, who had recently graduated from the University of Maryland. He was a Terp. Jamie died of an opioid overdose. He was part of the opioid epidemic that is sweeping the country. Rick Werner and his family were here in the United States Senate asking, in fact, pleading with senators, Republicans and Democrats alike, not to pass this health care bill. He had lost his son, Jamie, and he's determined that other moms and dads not lose their children to opioid overdose. And this bill, make no mistake, will make those tragedies much more likely by taking away access to care in the way Senator Donnelly just mentioned. Mr. President, yesterday, with the tie-breaking vote of Vice President Pence, the Senate began down a very dangerous path. But we can get off that path. We can make sure we do not reach the end of that very dangerous journey. It's like yesterday we lit the fuse, and the fire is traveling down that fuse, and at the end of the fuse is the plan to totally blow up the Affordable Care Act, which will wreak havoc on our healthcare system. And that's why we have to put out the fire on that fuse right here in the United States Senate. And we have the power to do that. We have the power to prevent the chaos and harm that will be created in our healthcare system if we continue down this path. And the reality, Mr. President, we know it, is that all the healthcare plans that we've seen emerge to date, whether it was House Plan 1 or House Plan 2 or Senate Plan 1 or Senate Plan 2, or the proposal to repeal entirely the Affordable Care Act, which would cause great harm, all of them have the same rotten core. All of them have the same nasty DNA, and that's this: that they would deny access to affordable care for tens of millions of our fellow Americans in order to give tax breaks to the very powerful and the very rich, to big corporations. In fact, the proposal we're probably voting on very soon, which is entirely repealing the Affordable Care Act with no replacement, will, according to the nonpartisan Congressional Budget Office, these are the referees, these are the nonpartisan referees who look at these proposals and tell the American people what the impact will be. The nonpartisan Congressional Budget Office has told the American people that the vote we're about to take will result in 32 million fewer of our fellow Americans having access to affordable care than today. They also tell us that we will double the health insurance premiums compared to today. And for what? And for what? They give a gigantic tax break to the wealthiest Americans. Warren Buffett, a name most Americans know, said about a month ago, for goodness sakes, I don't need a $670,000 a year tax cut in order to throw tens of millions of Americans off of affordable care. Don't do that. I don't need it. Make no mistake, this has never been about health care. It's been about wealth care. And I want people to think about this. If this were really about health care, why is it that all of the folks involved in providing health care to the American people are against it? The nurses, the doctors, the hospitals. People will hear a lot of facts and figures from senators here on the floor of the House. Some people may dismiss those numbers, but why don't we ask the people whose daily business is to take care of the American people? And what the doctors say is that all of these Republican plans violate their Hippocratic oath. What's the Hippocratic oath? It's the oath that every doctor in the country takes. And the first principle is, first, do no harm. Doctors, nurses, hospitals, they all want to make people better. They all want to cure us. They all want to improve our health situation, but their number one rule is don't make things worse. And all these bills make things much worse. That's what the numbers show us, and that's what the doctors, nurses, hospitals show us. I'd say it's much worse to have 32 million fewer Americans have access to affordable care. What about our colleagues? Don't they think that's worse? I think it's worse when you double health insurance premiums and raise the costs of health care to Americans. That sounds like it's worse to me, not better. And it's not just all the folks who provide health care. Why don't we ask all of the patient advocacy groups across America about this so-called health care bill? What do they say? The American Cancer Society, bad bill. Don't pass it. Will create harm. Will be a setback in our fight against cancer. American Diabetes Association, same thing. Bad news for patients with diabetes. American Heart Association, they tell us this will be bad, harmful to people with heart disease. Alzheimer's Association. You can go down the list. Every single patient advocacy group in America that's taken a position on this bill says it's a bad bill, says it's dangerous to our health, says it will do harm. So I don't know how our Republican colleagues can continue to bring Senate Bill 1, Senate Bill 2, Senate Bill 3, you name it, before this House and call it a health care bill when all the people who provide health care to our constituents say it's harmful to their health, and when every patient advocacy group that's weighed in says it's bad for their health. How is that a health care bill? It is good for one group of Americans, those who will get a windfall tax break, but many of them, like Warren Buffett, are also saying, hey, I don't want this. Now, there's some very big corporations that are wanting their tax breaks, and yes, as corporations, they're going to get this windfall benefit at the expense of everybody else in America and the expense of our healthcare system. So let's not go down this path. And the way to avoid going down this path is to vote down all of these amendments and make sure that we don't put this bill into the House of Representatives where they've already passed a bill that's harmful to Americans' health. In fact, I think people remember that President Trump had this big celebration in the Rose Garden at the White House after the House passed that bill. They were slapping each other on the backs before the cameras. But behind closed doors, what did President Trump have to say about the House bill? Behind closed doors, he called it a mean bill. And it is a mean bill. And these Senate bills, when it comes to cuts in Medicaid that our colleague Senator Donnelly was talking about, is even meaner than the House bill.